Good afternoon. Joe McComb, Mayor of the City of Corpus Christi. It's with great sadness that we announce today the passing of Deborah Garcia. Deborah was a city employee, valued member of the Corpus Christi Police Department family for 8 years, and worked in the Victim Advocate and Criminal Investigation Division. She dedicated years of service to our community by providing awareness, support, and service to the victims of crime. There's no doubt that her selfless efforts to fight the rights for those most vulnerable resulted in positive and lasting changes in the lives of the crime victims. And we send our deepest condolences to the family and friends of Deborah Garcia. It's always a sad responsibility to have to do that. And it's a stark reminder that this is a serious illness that we're dealing with, and that's why we're so adamant that you follow the rules and regulations that we propose to you and continue to remind you of it. These are people. They're not just statistics coming out of some other part of the country. They're people that live right here in our community. So we hope that you'll pay close attention to these announcements, and hopefully they'll become less and less frequent. Tomorrow morning at 6 a.m., the city's orders expire on August the 1st, and that basically means that we'll be back to, I guess, normal operations within our city 8 regional parks, our swimming pools, with the exception of the natatorium. It experienced some damage in the hurricane, so we'll have to let you know on the natatorium, but the other swimming pools will be open. Our splash pads will be open. And there's no vehicular traffic on McGee Beach or North Beach, so they will be open for people to go back and swim or rest or sunbathe or whatever they do on McGee Beach and North Beach, because there's no vehicular traffic on them. And yesterday, the county judge ordered the extension of the vehicular traffic extension to the Gulf beaches. And that order will take effect, and I think is good until August the 17th. Yeah. And that's just for vehicular traffic only. You're still, like you were in prior vehicular closings, you still have personal and pedestrian access to the beach, and go out and do your walking, your jogging, your surfing, your fishing, whatever you do there. I think there was some confusion within the community as to what could and couldn't be done. Well, it's basically a closure of vehicular traffic, but otherwise the beach will be open to pedestrian activities. So we wanted to clear that up. If there was any confusion, we hope that does that. And so, and the curfew within the beaches, I believe, is also part of the extended order that the judge issued, which is from sunrise to sunset, or 6 a.m. to 8:30 p.m. And that will go through the extension period, as I understand it, on the Gulf beaches. So we need to be aware of that, and you need to be aware of that. But that's I hope that clears up some misunderstanding. And but the city operations in our regional parks, our swimming pools, our splash pads, and McGee Beach and North Beach will be back to normal operations. We do caution you, though, going out to the parks and to North Beach and McGee, that the city staff has done a good job of trying to get all of that cleaned up, but there may be some debris that's still there that we missed. We hope we didn't, but just be aware of that, or it could be something buried under some sand that we didn't see at the time. So after a storm like this, be a little more aware of your surroundings, particularly I would wear some type of sandal or something so that you don't step on a nail or a piece of glass that was missed, because we don't want you to have a bad experience while you're at the beach. Since this is Friday, we have our report from Texas A&M, so we'll try to move a little quicker today, and I'll ask City Manager Peter Zanoni to come up and give his report on the statistics of how we're doing. And then Annette is here, I believe. Yes. And she'll be here, and then we'll have the report from A&M on how we're doing, and hopefully it's a good report. I haven't asked them, so I'm going to wait for it to see their report, but hopefully it's a good one. And it will be good in terms of information as we move forward. So Mr. Zanoni, if you'll come, I guess they'll clean the podium and then come up and give us our statistics for the day.
Con mucho dolor quiero expresar mi sentido pésame a la familia de Débora García, quien trabajó con la ciudad de Corpus Christi al servicio de las víctimas de crímenes en Corpus Christi, Texas. Es por noticias así que les recuerdo la importancia que es tomar precauciones y que sigan tomando las mismas precauciones. Mañana las albercas se abrirán con excepción del natatorium. No habrá acceso vehicular a las playas hasta agosto 17 y por favor tengan mucho cuidado cuando caminen en las playas. A continuación, el reporte del gerente de la ciudad.
All right, good afternoon, everybody. My name is Peter Zanoni. I'm Corpus Christi City Manager. And I'm going to give you an update on the statistics for the day, number of new cases, number of hospitalizations, number of deaths. And today we have to explain a little bit of an anomaly in the numbers. We have basically a pretty significant number of new cases that spread an 11-day period that we're going to explain. You'll see in the numbers. So people that have been watching and maybe tracking this pretty closely, you're going to see about a 50 number increase in every day for the past 11 days or so, and I'll explain that in a moment today. Okay, but let's begin with this graph that we normally show. This shows the number of new cases in Nueces County. And when we look at today compared to yesterday, we have 32 more cases, new cases today than yesterday, additional unduplicated new cases. So today we have 356, which is 32 more than yesterday's 324. And if we look at the week, which began Sunday, 7/25, that 7-day period today is the highest number of new cases. Okay, so 356, over 350 new cases for the week, and the largest one-day number of new cases for the past 7 days. Now, let's look at this next slide, and we're going to go back and forth just so especially the group that watches this every day. So, back in mid-July, the state Department of Health and Human Services told all health districts like ours that we can help you manage some of the caseload, meaning we can take what's a confirmed positive and tell that person the positive, and then also do tracing. Our health director said, you know what, thanks for the offer, but we don't want the help because it may be a little too confusing to manage the data. And that may have been the case for other health districts across the state. Some took the help, some didn't. But on the 19th of July, the state said, it's no longer an option, we're going to do it. We're going to help you manage the caseload. And so from July 19th to yesterday, July 30th, they did that, and that's good because we had a lot of cases to manage. That means they called people and said, you tested positive, and they talked to them about where have you been so they could do tracing and talk to other people that may have been around this person that had COVID. So all that's good, but what they're going to do a better job on is giving us data that we can put into our database in a more timely manner. So yesterday, for the work that they did from the 19th through the 30th, they basically gave us all those cases in one report, one data dump, and that constituted 555 confirmed cases that we didn't have in our database until yesterday. Okay, so what the yellow represents are those 555 cases that would have been reported to us on the day they were confirmed and the day that the person was notified, and we got them all yesterday. So we're adding them back to the historical levels. And going forward, like today, we have the state's number in there now because we've talked to them. We said, you know what, we need to get your numbers at least every day or every other day, so we don't have this having to go back and place them on top of the numbers we already reported. And so that'll be corrected going forward, and the numbers will be in our database. So that's what these bars represent. So you can see this week, when we were up here reporting, we reported 230, 254. Let's see, let's do, Saturday was the 25th. Let's start there. So we reported 215, but the real number is 239. And on this day here, we only reported 66. The real number would have been 95 using the state's numbers that they helped us with, or the state's number of cases that they were managing. And so Monday, we reported 230. But with 116 additional cases, really the number of cases that day was 346. Tuesday, you can see 254. We had to add 18 more. Wednesday, I reported from here 259, but with 79 additional cases managed by the state that they just told us about yesterday, that number becomes 338. And then on yesterday, 7:30, we said 230 confirmed, but with 94 additional that the state has been managing, the real number is 324. Today's number, 356, includes both the states that they have managing and our numbers, okay? So let's go back to the first slide again. Yeah, so you can see this week was really a series of 300s, not 250s. And let's go back to the new slide. And you see this, we were reporting kind of in the 200s, but when you add the state's caseload on for cases here in Nueces County, it brings it up to that 300 level. Okay, so Annette's going to be coming up next. We'll keep an eye on Facebook. If there's any questions on that, she can go over it again, and I can go over it again at the end of the briefing. Okay, so let's look at the next chart that shows progress in terms of persons recovered. We're very interested in that, and as time progresses, persons get better, and if less people get the virus, then the recovered slice of this graph gets bigger and bigger, and that's what we want. When we were doing pretty good, the amount of recovered cases was almost 60% of the graph. So today, there's 4,113 persons of all the cases that we have in Nueces County that have recovered. That's 34%. And then a little over 8,000 cases are still active, and that 66% represents 66%. There's 176 deaths. There were 10 additional today, and we'll show you that graph in a moment. Okay, some good news on the hospitalized patients. So today there's 358 in the hospital recovering from COVID-19. Yesterday there was 387, so that's 29 fewer persons in the hospital recovering. And that's a good sign. And then also in the ICU, those patients that are in the hospital, the 358, 133 are worse off than the general population, and they're recovering in ICU, and that's 11 fewer than yesterday, where there were 144 in ICU. So 133 today in ICU. And as I mentioned, we had 10 additional deaths, and when you drill down on that deaths, those all didn't happen today, but a lot of our data is based on when we're being told, either when a test result came in or it was finally sent to us. And the same thing on death. Sometimes hospitals are so busy they can't tell us everything in the exact minute that it happened. So a number of the 10 deaths today actually happened a day or days ago. We're just getting the information today. So I just want to put that in context, that the number of deaths in one day wasn't 10, it was something less than that. The week has been about 8 a day. Yesterday was 4. So today we're probably around that same 7, 8 number per day. But we're reporting 10 because that's when everybody, the hospitals and other places tell us the number of deaths. So we had 166 yesterday, with 10 additional being reported to us. We're at 176 deaths in Nueces County. Okay, and then our final graph shows us a trend line. It shows us it shows us two things: a 7-day average trend line but also shows us a number of daily new cases every day. And you can see this has been our issue we've been addressing here, the big number of new cases in late June and July. You can see maybe from your TV or your phone that our trend line was beginning to go down, but it's coming back up in these last couple of days. And Dr. Bird probably will have some better graphs in his presentation. But you can clearly see we had a big peak over here, kind of mid-July. And since that mid-July timeframe, the 7-day average number is coming down a little bit. But we're a little worried with this reverse trend here, the line's kind of going back up in the last couple of days. So with that new information from the state for the cases they were managing for us here, the daily average now is 281. And it was about 222, 202 or so earlier in the week, but with all the new data added, it's 281 is the 7-day average. So today's number of 356 is much greater than our 7-day daily average. Okay, so that concludes the stats on the COVID cases. We're going to get that translated into Spanish, and then Annette is going to come up. Thank you.
En las últimas 24 horas se han reportado 356 casos confirmados por el coronavirus. 4.113 pacientes se han recuperado por completo, 358 continúan en el hospital, 133 están en la unidad de cuidados intensivos. Hoy se reportan 10 fallecimientos. A la fecha, los fallecimientos totalizan 176 personas. Quiero aclarar que 10 son el número de personas reportadas hoy. No quiere decir que el fallecimiento ocurrió en las últimas 24 horas, sino que fueron reportadas hoy.
Good afternoon. Annette Rodriguez, Public Health Director. I first want to extend my condolences to the family of the 10 individuals that lost their battle against COVID-19. I want everybody to think of the power of one. We all know that COVID-19 is a highly contagious disease that spreads very easily from person to person. All it takes is one infected person to close an entire restaurant. One infected person to cause an entire family to have to quarantine for 14 days. One infected person to break up an entire social gathering. One infected person to close an entire business office. One infected person to send a nursing home resident to the hospital. I can go on and on with other examples. On the flip side, if you are positive, you have the power to stop the spread of the virus. It only takes one mask to stop the spread, one person to wash their hands frequently, one person to distance themselves 6 feet from others, one person to disinfect commonly touched surfaces, one person to stay home. We all have the power to be the one person who stopped the spread of COVID-19. Stay well, stay healthy, and as always, stay informed. Thank you.
Mi más sentido pésame a las familias de las 10 personas fallecidas. Todos sabemos que el COVID-19 es una enfermedad altamente contagiosa que se propaga fácilmente de persona a persona. Aquí hay algunos consejos importantes sobre lo que todos podemos hacer. Una persona infectada puede cerrar un restaurante completo. Una persona infectada hace que toda una familia tenga que ponerse en cuarentena durante 14 días. Una persona infectada puede terminar una reunión social completa. Una persona infectada puede cerrar una oficina comercial. Una persona infectada puede enviar a un residente de hogar de ancianos al hospital, y los ejemplos pueden continuar. Por otro lado, si usted porta el virus, usted tiene el poder de detener su propagación. Solo se necesita un cubrebocas para detener la propagación, que una persona se lave las manos con frecuencia, que se distancie al menos 6 pies de las otras. Una persona que desinfecte superficies comúnmente tocadas, una persona que se quede en casa. Cualquiera de nosotros puede ser esa persona que detenga la propagación del virus.
Good evening, everybody. My name's Dr. Chris Bird. I'm here on behalf of the Task Force for COVID-19 here in the Coastal Bend area. We have a lot of ground to cover and some kind of thorny issues with data that I want to try to make clear for everybody. But we'll start off with talking about our task force objectives. We're here to help to address your concerns and questions about COVID-19 and the interventions that are taking place. And maybe in a week like this, when almost every data stream that we have changed, explain how those changes affected the numbers and kind of why things are different now than they were before. And City Manager Zanoni did an excellent job of setting this up for me. I'm glad because I didn't have a nice detailed graph like he did there. And we want to enable evidence-based decision making. You need to make decisions for a whole community based upon all the available information, not just your gut. And so that's what we're here for, to try to provide that data and the science to help guide decisions. So we're going to start, like we always do, with the definition of an outbreak. We're in an outbreak. Outbreaks can be big around the whole world. There's an outbreak around the whole world right now, the COVID-19 pandemic. And they can be small. It can be inside of a building or at a particular business, which we experienced back in May. Presently, we're experiencing a Texas-wide, if not a whole south of the United States-wide outbreak of COVID-19. This graphic shows you how COVID-19 can spread. Each iteration is about a week in time, and it spreads from 1 person to 2, 2 to 4, and that would be if the transmission rate was 2. And in most of the places around Texas, the transmission rate got all the way up to 2, which is really high. Here it got up to 3, and it was even higher, which is why we've been at the top of the state in a lot of dubious statistics, like the most cases per day, and sometimes even in the top of the country. COVID-19 is transmitted in a variety of ways. It's transmitted through the air. Now, I know that there's been some news stories out there where some scientists and eggheads are arguing about whether it's airborne or not. And the thing is it's definitely airborne. The only question that the scientists are arguing about is how big of a particle are they being transmitted in. For us, it's airborne. And it can be transmitted on surfaces and through contact. There's even, I've seen this week, some discussion that maybe everybody's going to be recommended to wear eye protection as well as masks. And I've seen several indications that you could catch COVID by droplets landing on your eye. So these are the different ways that COVID can be transmitted. We have a variety of interventions in place to try to keep this transmission down. Stay at home if you can, social distance, wear face coverings, self-isolate when you're symptomatic or if you've been exposed. For example, there's some NBA players this week that have to go through a quarantine just because they may have been exposed to COVID-19, and that's the responsible thing to do. There have also been school closures in place, which have all helped to decrease the transmission rate. We started to open Texas back in May and have stepped from Open Texas Phase 1 through 3. And on June 26th, we realized that Open Texas Phase 3 was a little too open, and the governor rolled that back to Open Texas Phase 2. And then Phase 2 has been partially rolled back since the week after that, and that's where we stand now. If you're following this all the way back to the beginning of the pandemic, we're in the longest period of time with the same basic interventions in place at the state level. And it doesn't seem like today is the last day of that either. So these interventions, they're in place to decrease the transmission rate. Our estimate of the transmission rate is the same as it was last week, 0.9. And this is good. When the transmission rate is below 1 and not a lot of people have been infected, then on average, one person infects another person, like so. And at 0.9, it's about the same. There's a 90% chance that each person that contracts COVID is going to pass it on to one additional person. After 3 weeks, you have another person, 4 weeks, another person. And in total, 5 people infected in 1 month. The gray areas in the background are what it would be if we were at a transmission rate of 3, which we were about a month and a week ago. Now, 5 infected in a month is a lot less than the 120 that are there in the grayed out area. However, at this point, a large proportion of the Coastal Bend area has contracted COVID-19. And when I say large proportion, I mean more than 10%. And what that means is when you have this high of numbers having COVID-19, even with a low transmission rate, a lot more people get COVID. So it's good that the transmission rate is low, but there's a lot of people out there with COVID, so we need to keep it low for a while so that we can get the number of cases down and the number of people infected down. This report's for the 12-county Coastal Bend area, not just for Nueces County. Here we have graphics of the total number of cases in the Coastal Bend as well as in all of Texas. Just focus on the colors, the brightest colors, the darkest colors. Those are the areas that are the most heavily impacted by COVID-19 at this point. We're gonna drill down into this. And here we go with trying to describe what has happened with the data. First off, Manager Zanoni did an excellent job of describing that we had to backfill a few days worth of cases from July 19th through the present. That's in here. There's secondarily an issue where the county was reporting both probable and confirmed cases together, and that has now stopped. And if you noticed in the newspaper on reports, they're now showing the number of probables and the number of confirmed cases. What we've done is we've gone back in time and separated these out all the way back to when they started. So everything that we're showing is confirmed, as far as I know, at least as much as I can do on the graph to fix the data. We're showing confirmed cases, not confirmed, plus probable cases. I think that I'd be correct in stating that what you saw in Manager Zanoni's presentation, they were the probables and the confirms together. So that's a difference here. So why did I choose to do this? The reason why I chose to whittle it down to just the confirmed cases is because the rest of the state is also reporting just the confirmed cases. And for us to make comparisons on a level playing field between the Coastal Bend, between different counties in the Coastal Bend, because this is mainly a Nueces thing, we need to get it down to the number of confirmed cases. So that's this line here, the total number of cases here. The reason why it might be pretty close or maybe even lower in some cases than what you saw in Manager Zanoni's presentation is that these are confirmed, not confirmed plus probable. So 12,109 confirmed cases in the Coastal Bend area. And about 6,000 active cases right now, 6,200 active cases. You can even see right here, this is where I can't disentangle the probable positives here from the confirmed positives, and then from here forward I can. So you can see that jump in the data points there. Now this doesn't have any big impact here, but for these it's very important that they're all confirmed because we calibrate our models off of that. And there's about 5,700 recoveries. Again, these are corrected for just confirmed cases, not confirmed, and probables. So that's why the numbers are different, as well as this is for the whole Coastal Bend. So hopefully that's clear. Moving forward. Okay, so there was a first wave. It was way back here, and we flattened that wave. Now back during that wave, before we had the tsunami that's occurring right now, it looked like a big curve. And then after that, in May, we had another set of outbreaks locally, and that was a very steep curve. I remember being very stressed out about that and trying to help you guys understand if it was going to spread throughout the community or if we were going to be able to contain it. And now, what's happening now just dwarfs those first kind of forays that we had with COVID outbreaks, and now we're in this full-blown outbreak, the Texas-wide outbreak. We estimate right now that about 1 in 10 people in the Coastal Bend area are actively infected with COVID. And the good news is that's less than last week. And that's the first time that I've shown this, that it's less. Now, how do we get to 1 in 10? Well, we have 6,000 active cases. That's where we start. Now, the CDC and other scientists have done studies where they go back and they test a community after an outbreak has occurred, and they've determined that between 2 and 20 times more people contract COVID than are test positive, and on average 10 times more people are COVID positive than actually get confirmed in the stats. So if you multiply this by 10, that's 61,000, 62,000 people infected. There's 600,000 people in the coastal bend. It evens out to about 1 in 10 people actively infected right now. And that's where, it's a large proportion of the community, and we want to get this down so that you're less likely to encounter COVID when you're out there, and then less likely to pass it on to others. Next, for the proportion of positives, I know there's a proportion of people out there that really like this statistic. It's the hardest one to get at because the nature of the data, the tests go out to all these different testing agencies and private companies, and some of the private companies share the negative results and some of them don't. And then Public Health Director Rodriguez has to sort through and make sure that we only count one person once. Each person once on the positives and on the negatives. And where we can really do a good job of that is on the mobile testing stations that have been around the coastal bend area, taking tests from people and giving them results. We get all the negatives, we get all the positives. And that's why this is a good data set to do this with. It's not all the tests, it's a proportion of them. And right now we're at 25% of all the tests are coming back positive on average. You can see this model fit through here. These were the last two data points that we got that brought it up a little bit from where we were last week when I showed this. Now there's a little bit of a lag. Now these aren't too bad, maybe July 25th or so in terms of when these data points came from, but we don't get all the results from these obviously immediately because the tests have to be run and the results have to be received. So 25% positive and that's our best estimate of the percent positive rate. Now, in terms of how we stack up against the rest of the state, and this is one of the important reasons why I had to convert the numbers to confirmed cases so we could compare on a level playing field. The coastal bend is currently has the third most average new cases per day per capita, which in this case means per 100,000 people. The other places, if you look closely, Victoria, Laredo, Lower Rio Grande Valley, Galveston, they tend to be places in the southern parts of Texas on the coast or in deep South Texas. And I think it's well known at this point that this is where the largest COVID problems have occurred. We continue to rank highly here, but hopefully we can get down lower on this list if we continue to social distance. We can compare South Texas. Here, Public Health Region 11, this is us, it's Laredo, it's McAllen, and together we make up this large public health region. The whole state is broken up into these different public health regions, and what I did was I named ours South Texas, and the other ones I named them according to a famous city that occurs within that public health region, and you can see that every single one of these public health regions right now in terms of new cases per day is going down. And so that's good. And you saw that same result in City Manager Zanoni's data set for Nueces. If we look at the just southern Texas, this is Public Health Region 8 and 11, so San Antonio, Victoria, as well as some other major areas in the very southern parts of Texas. You can see that we're trending in the right direction. And again, this data for Nueces, I've corrected it so that it's just confirmed PCR positive cases, and it's bending and going down, and that's good. Victoria going down, Laredo leveling off, and Brownsville is really the only area that's really still going up on this graph right now, which would be the whole county that Brownsville is in, not just Brownsville. Okay, if we zoom in on the coastal bend, not just Nueces. So we talked about Nueces here, but what about the other places in the coastal bend? We have B County with the most new cases per day on average right now, and it's trending upwards. San Patricio is trending downwards, and that's a good sign. Live Oak, though, has really shot up. I'm not privy to what's driving some of these dynamics. But maybe the people that live in these areas know a little bit better. Maybe the news can help you out with that. And then down here, some of the other places in the coastal bend. Now, I want to remind everybody that back in May, none of these places would be able to be seen on the scale of this graph. They'd all be flat lines at the bottom. And Nueces maybe would be just barely visible here in this lower portion of the graph. So that's how many more cases that we have now, where these small counties surrounding Nueces County are, have more cases than we did a month and a half ago in Nueces. Okay, let's transition to hospitalizations. So the way it works is you get infected with COVID, then it takes about 5 days before you start to become symptomatic, and then you might test positive. If you have a really negative reaction, you might end up in the hospital. And so we're going to look at the hospital data next. We're going to go through this in that progression. And so in terms of new census hospitalizations, we're at third again in the state, which is not good. It's a bad thing to be third. We want to be all the way at the bottom, where there's approximately 60 to 70 people per 100,000 in the hospital right now. This could be in the ICU or in general admission, and the doctors out there call it med-surg, which stands for medical and surgical. So we've got a ways to go here with the hospitalizations. Here's a graph that shows the ICU, the ICU census right now. The blue is not COVID, and the red is COVID positive patients. And in previous weeks, we tried to put in the amount of available beds, and this is the second way the data changed on us in the past week. I think everybody's aware that the federal government decided to change the way that this hospitalization data was collected, and all the hospitals had to start filling in new forms, and it was confusing. And we have this kind of barber pole right here with the date that none of the data that I've looked at is reliable. So we just removed the data from this date and put that poll there and said before this point, the data was being collected one way. After it, now this new way for the federal government, and it caused some problems. Because of that, we can no longer calculate the number of available beds right now. And so we're just showing you the number of COVID occupied beds and non-COVID occupied beds. What you can see is that it's been going down on average for ICU census in the Coastal Bend area, so that's a good sign. In terms of med-surg, so these are the general admission beds. If you become an inpatient but you're not in critical condition, you go to a med-surg bed, and there that's kind of come up, and we're right around the peak for that also. Normally we would peak on med-surg before we peak on ICU, so I'm not quite sure what's driving this, but sometimes there's internal hospital dynamics where because of overload, patients are differentially put into different categories to help to spread the load around. I'm not privy to why, but normally we'd expect this to peak before ICU, but it looks like they're peaking simultaneously. And here's our model that predicts what's going to happen in the future. So this is number of people in the ICU. Same data as you just saw in the previous graphs, just shown in a different way. Each point here is the number of people that were in the ICU on a particular day. If you're in the ICU 2 days in a row, you count once on one day and you count once on that other day also. If you're in the ICU for a short period of time and you come out, I believe you might not count for that day. It depends at the time when the data is collected, usually about 7 a.m. So the points are the real data. The dark line and the ribbon are the model. And the model, I've left it the same since last week. The model predicts that we're peaking right around where we're at now, and it's over predicting the number of people in the ICU. So that's a good sign right now. We have less people in the ICU than were predicted last week. The peaking seems to be happening right around when the model was predicting it. And if you're wondering, well, how come I didn't update the model and recalibrate it? When we look at all the people in the hospital, it does a pretty darn good job of fitting the data. So this is maybe a matter of how many people we have in med-surg versus how many people in the ICU in the model. And in general, the model's doing a great job of projecting how many people are in the hospital, and you'll see that we're clearly past the peak. This data point is from that day when the forms transitioned from the old way that was within the state to the federal way, and there was confusion about how to fill it in, leading to this is an erroneous data point. There wasn't a big jump in the number of people in the hospital on that day. Just showing you why we eliminated that day from the other graphic also. Okay, so we're kind of going down in terms of numbers of people in the hospital, and that's good. Now we move past there. If you go to the hospital and you have a really negative outcome, a really negative reaction to COVID, and you're really susceptible, there are a certain proportion of people that end up with a fatal outcome. Right now, in terms of number of fatalities per capita, we're at number 3 in the state. Okay, now I need to, again, talk about another data issue that City Manager Zanoni started to touch upon. I'm going to get into it a little bit more deeply. So if you notice, the date here is 7/20, and today is 7/31. So what's happening is there's been a change statewide in the way that fatalities are being recorded and reported. And now they're going off the date on the death certificate rather than the date that the public health directors are able to report that those people passed away. Now what's happening is that there's a delay between when somebody dies and when the death certificate gets sent to the public health department. And then there's a delay between when the state gets the data and when they post it to their website. So there's not just delays due to kind of data-like issues, but there's also delays on the hospital side where it takes a little while to get to push those forward. And so this new way of doing it, it takes longer for us to get those numbers. So these are the rankings based upon the new way of collecting the data. You cannot trust the data. Let me rephrase that. You can trust the data, but you can trust that the data is incomplete for the past 10 days in fatalities in the new way that the data is reported, because death certificates don't need to be reported until at a maximum 10 days after the person dies, so there can be all sorts of delays in there. And because of that, and we can clearly see this in the data, and I'll show you in the next graph, you don't have to trust me. This is why we're doing it like this. So we can only compare amongst all the places in the state, basically a week and a half to 2 weeks in the past in terms of fatalities, because the fatalities that are reported for today are incomplete and they'll be updated, say from July 31st. The fatalities reported today by the state will be updated tomorrow, the day after that, every day up to 10, maybe even 14 days after that day before you really get to a complete number of fatalities reported for that date. The good thing is that date is actually the date that the people are passing away, and not that that's very good, but it is a better keeping of the records, which is why the state did this in the first place. So we're not recording when the fatality was reported, we're recording when the person actually died. So that was a lot of lead-in to this graph. You can see the effect right here of not being able to calculate or not being able to log all of the fatalities using the death certificates immediately on the same day that we're in now. The dark points are the old way, and we still have that. You saw City Manager Zanoni present the number of fatalities that we have for today, and this includes that in here, the dark points. And this is the same way you've been seeing it for the past several weeks. The red points are the new way, and you can see the delay here from the time the person dies to when the death certificate's filled out to when it gets reported. There's a little bit of a delay of a few days on average. And you can see that there's a very close tracking between these two data sets. I was a little skeptical. I didn't know why this was happening. Maybe somebody's trying to cover something up, right? But what it looks like to me is that the new way of reporting seems to capture the same qualities as the old way of reporting, but not for the immediate term. So these will get filled in as time goes on, and this is not a real phenomenon of less people dying over the past 7 to 10 days. This is a phenomenon of them not being recorded in the state system yet. So hopefully that was as clear as I could possibly make it. So the difference here right now, 162 fatalities that we know of, 136 of them have made it into the state's database at this point in time, and that's for the whole Coastal Bend area of people that were confirmed COVID positive. The one other thing that I need to explain is that with the death certificates, there's a couple sections where you can fill in why it was that somebody died. And the first line is the proximate reason they died. It could be heart failure. It could be asphyxia. There could be a variety of reasons why people die. It's very rote. I think a lot of us have had relatives that have died of cancer. Cancer is never the first one on the list. It's something else, right? You had cancer and then your lungs filled up with fluid and you were no longer able to breathe, or you got pneumonia. There's a variety of things that happen there. So same thing with COVID. COVID's usually not the first thing on the list, but then there's a couple additional things on the list where COVID might be one of those. If COVID is anywhere in that section 1, which has 3 or 4 slots in it, then it gets counted here. If COVID is stated in section 2, which is below, which are additional contributing causes on top of both the proximate and major contributing causes, then it doesn't get counted with the state's method now. And so if you do see discrepancies in the number after the numbers fill in, it could be due to, in the past, something in section 2 had COVID, and we might have recorded that in the county as a COVID fatality. Now the state won't record that as a COVID fatality. But it seems like that discrepancy, at least thus far, is not very large. Okay. Now that everybody's thoroughly put to sleep with these data issues and the intricacies we had to deal with this week, this data is now that state level data. And the part that I like about this is that it was really difficult to get our models to fit the way the fatalities were coming out, because they were coming out later than what our model said they should. Now they're lining up really well. So in that respect, it sets my mind at ease that our model is doing a fairly good job of predicting what's occurring. And it was a cause for concern for me before when we didn't have a good alignment in the timing at which the model was predicting fatalities would occur. So the model predicts that right now, even though we only have data points over to here, remember we have to delay those because for the past 10 to 14 days, we don't have good numbers from the state. We are right around here right now, which is at the peak of the number of fatalities per day as predicted by the model. And so we expect that from here forward, if we can continue social distancing the way that we have been, that these numbers should start to go down. And you can see that the number of new cases per day is really variable. Some days it's higher, sometimes it's lower. You can expect this spread to kind of continue forward and then start to go on that downward slide as long as we can continue doing what we've been doing. So that leads us to our last section. What have we been up to lately? The things that we've been doing in the past 10 days to 2 weeks, they don't show up in the case data or the fatality data or anything else like that. So that's why we show the cell phone data, where we can look at things like foot traffic at restaurants, the amount of people that are leaving home, potential encounters between different people when cell phones come close to each other. And I know a lot of you have privacy issues. None of you have to be tracked by these cell phone apps. You can choose to say no when Google Maps asks if they can have access to your GPS. You turn off your GPS locator. You can make sure that all the apps that you have on your phone don't get access to your location. However, if you do give them access, you can pretty much well bet that you're being tracked by the data that we're using here, and all sorts of apps and different programs out there use it. Here, at least we're using it to try to help you and at least let us know what's happening. Okay, so the red line is distance traveled. The average amount of distance traveled, this is a positive development from last week where that was kind of leveling off. It's continued to go down now. And there's one major outlier here, and I think everybody can identify what that's from. During Hurricane Hana, there was a very low amount of travel and also a very low amount of people leaving home. So these two data points, that's on the day of the hurricane, and we have a more of a downward trend. So the silver lining of Hurricane Hana is that it helped us with social distancing for COVID. And that will definitely stop transmissions from occurring that would have occurred otherwise had we not had that hurricane. I know there's not too many silver linings of a hurricane, but there's one that we had here. Second, potential encounters, and again, I'll describe, so these are the different open Texas phases, 1, 2, 3, backing off to 2, and then what I'm calling 1.5 right now, where we're at now. 100 is normal. That's 100% of normal based upon the behavior that people were exhibiting in February and March. Sometimes that might not be indicative of the summer, say with like beaches, and we'll see that in a second. But here with encounters, what you can see is that from the beginning of May, and I've kind of slid this over now, I'm not starting from the beginning of the pandemic, I'm starting from the beginning of Open Texas Phase 1. We saw an increase in the amount of encounters and then a decrease, and it's kind of leveled out. So this is a positive development from last week where this was starting to trend up, and you can see the points here, 1, 2, 3, 4, 5 weekends. So that's a Friday and a Saturday, and then last Friday right before the hurricane. Now that's bad when that's going up like that, but with the hurricane, we have this data point down here, which kind of offset that and gives us this flat line. We don't want to see these numbers of potential encounters increase, and here's why. When we were coming down over here, we were wearing masks. And as we avoided encounters, we became less and less likely to transmit COVID, either to catch it or to transmit it. Now, the same thing's happening now. People are still wearing masks. As the number of encounters go up, even if you're wearing a mask, the probability of transmitting it increases. And so we want these to come down and stay down until we can really get the amount of cases in the Coastal Bend area to a reasonable level. I know we're a little bit numb at this point, and 300 something cases day after day after day, you start to get numb to it. But remember when there were 0 cases day after day? That was not more than a month and a half ago, and we're nowhere near that point in time. And just because we kind of rounded the corner here on number of new cases recently, doesn't mean that if we back off on the social distancing that it won't go back up. So it's very important for us to continue to keep these low. And if you remember, I'm going to back up to it. The curve is not that steep coming down. It's not like, bottoming out. It's slowly, and turning and going down. And it won't take a lot for that to level off or to go back up. And so that's why we're continuing to encourage social distancing and say that if we can stay like this, that's good, but there's a little warning sign here in the weekend behavior that happened up until the hurricane. All right, non-essential gatherings. These data points are week-long averages, and so the hurricane is baked into the last data point on the graph in these different metrics. You can see that they're moving in the right direction. And they were level last week with the hurricane. They went down a little bit. We might expect a bump back up in some of these with the malls, restaurants, and bars, but if we could keep it where it is now, that would be fantastic in terms of stopping COVID. All right, last, recreational foot traffic. Again, here the last data point is the one that's affected by the hurricane. It's a week-long average. And as you might expect, not a lot of people wanted to go to the beach during the middle of a hurricane and probably didn't come down to the Coastal Bend area. And even then, we were at 100% of the beach activity back at the beginning of Open Texas Phase 1. So during the hurricane, there was as much beach activity as there was back at the beginning of Open Texas Phase 1 in late April, early May. So it's still, there's probably some people out there. Okay, the summary, we're in a Texas-wide outbreak. It's not over. It's still happening. I know that we've been at this for a month and a half. Here on the task force, we've been watching this since the first week of June. And it almost seems like yesterday. At the same time, I know that's a long time ago. We need to stay the course here. COVID-19 cases have spiked and peaked, and they're starting to come down. That's a good sign, but we can't let up. About 1 in every 10 Coastal Bend residents has COVID right now, or is infected with COVID right now. They're infected with COVID. And this is a cause for concern. That's a lot of people. If you go to the supermarket, if we randomly drew people from the community, there's a good chance that several people in the supermarket have COVID. COVID-19 ICU usage and fatalities is predicted to be peaking now, and not only is it predicted to be peaking now, the data kind of looks like it's peaking now. So I'm optimistic, hopefully optimistic that that is the case, and next week we'll see that coming down and it'll be real obvious. The transmission rate right now is a little bit below 1 at 0.9. We've been there since last week. This transmission rate, I will let you know that it is delayed. What you do 2 weeks ago affects what's happening now. So this transmission rate is really based on 2 weeks ago. The cell phone data tells us that it's going to continue. And so that's the good message there. And the hurricane aided social distancing efforts, and so there's the silver lining of Hana. And we need to continue these efforts to reduce transmission. It's not time to relax. Even though we're coming down, this is a freight train. Right? COVID-19 is a freight train, and it's going to speed up if you don't try to slow it down. Right now, we've just stopped it from speeding up and have just started to slow it down a little bit. But it's still going really fast. Was it 300-something cases today, right? Right. So it's way too many cases for our community, and we need to continue and stay the course here. And I know that everybody in our community is capable of this. We flattened the first curve, and now we're going to flatten this curve too. Everybody can help contain the outbreak, from managers and bosses and owners of restaurants. For here, COVID's bad for business. There's no doubt about it. And the less COVID there is, the better your business is going to fare. So it's in your best interest, if you own a business or if you're a manager, to try to help to curtail COVID and to help it recede. So one idea would be no shirt, no shoes, no mask, no service. Close loopholes in social distancing policies. I think at this point we know COVID found our loopholes in the whole state of Texas and caused this outbreak to occur. It's around, it's going to find it. This isn't the first time we've done this before. Back in 1918, there were mandatory mask orders that were in place. Here you see the whole Seattle police force trying to social distance. Not as far apart as they should be, right? We've come a long way in 102 years. We know that we should be 6 feet apart and not 2 or 3 feet apart. But they knew back then that masks were a good idea, and they're a good idea today. And you got to imagine that our masks today are much better than the ones they were using in 1918. And for everybody else, again, with the masks, say you wear a mask around your chin, it's as good as wearing no mask. Or if you wear a mask around your mouth but not your nose and you sneeze, it's as good as wearing no mask. What this is a picture of Petri dishes where bacterial colonies were incubated from a person coughing twice, talking for 1 minute, singing, and sneezing once without a mask or with a mask. And while COVID-19 is not a bacteria, it's a virus, COVID-19 is transmitted in the same droplets that transmitted those bacteria to those plates. And the mask stops the droplets. So if you have COVID, and you might have COVID and not know it, there's a lot of people that are asymptomatic, and they can still transmit COVID. And for everybody else that actually gets symptoms, you're the most contagious before you have the symptoms. And so you don't know you have COVID when you're transmitting it the most. That's why it's important to wear a mask and also to help stop you from getting it. So wearing face coverings is a good idea. Social distancing, a good idea. 6 feet is good, 12 feet's better. 3 feet's not as good, but 3 feet's better than 1 foot. It's a continuum. Stay at home if you can, self-isolate if you're sick. Practice proper hygiene, wash your hands a lot, try not to touch your eyes. If you touch your face, it's better if you touch your face with a mask on it. That's one of the things, if I'm in a place, say at my office, and I'm alone, I still wear my mask because, I just touch my face all the time, and I can't stop myself from doing it. You do it unconsciously. And so by having the mask on, at least when I go to touch my face, I'm, oh yeah, I shouldn't touch my face, I have the mask on. So it reminds me. Avoid social gatherings, especially larger ones. There's still a lot of COVID out there. It's not time to have that party yet. Curbside and takeout is less risky than going inside of enclosed buildings where people may be coughing and sneezing, and not everybody is necessarily wearing masks. And it's important to support testing and contact tracing. These are some of the ways that we can contain COVID. Although where we're at now, we need a real lot of testing and contact tracing to contain it. Remember, back in mid-May, we were able to contain those outbreaks by testing and contact tracing very effectively because they were so isolated. So anyway, we want to try to help to reduce the amount of people that have COVID. So that's all we have for today. I want to acknowledge everybody on the task force. There's a lot of people that contribute to this every week, and this week's no different. I want to thank all those people, and we'll go to a translation.
Potencialmente, 1 de cada 10 personas tiene COVID en este momento. y la tasa de transmisión sigue siendo de 0.9. 12.109 casos confirmados en los condados de la costa, 6.192 activos, 5.755 recuperados. Los condados de la costa son los terceros en casos positivos per cápita en Texas. También somos los terceros en hospitalización per cápita. Se estima con el modelo estadístico que para la próxima semana lleguemos al máximo número de personas en la unidad de cuidados intensivos, pero si continuamos con las medidas adecuadas, los números bajarán. El protocolo cambió en cuanto al reporte de defunciones. Los fallecimientos son reportados en el momento que se firman los certificados de defunción. Basados en esto, los condados de la costa también somos los terceros en este momento en fallecimientos per cápita. ¿Cómo detenemos la propagación del COVID-19? El cubrebocas disminuye la transmisión hasta en un 50%. Sigan el distanciamiento social de 6 pies, quédese en casa y evite eventos sociales.
So I think we have time for Facebook questions or.
Thank you, Dr. Bird, again. First question is, how does closing down places help, for instance, the beaches and bars and stuff, and that may be both Peter and Annette?
All right, well, limiting access to beaches, the main reason to do that is to try to prevent people from coming to the coastal bend from other places and then either contract COVID and bring it back or bring COVID with them. When you come here for the weekend, for a long weekend, you're staying at somebody's house or at a hotel, you're eating out at restaurants a lot of times, and those sorts of behaviors are risky right now. Bars, I think, is well understood at this point that it wasn't a great idea to have those wide open and may have been a major contributing factor to the present outbreak we're in by having this location where, by the nature of a bar, you talk a lot. And when you talk a lot, you expel droplets from your mouth. And you talk loud because it's loud in the bar. So then you expel more droplets from your mouth. And you're not wearing a mask because you're drinking. And then your inhibitions and your logic is affected because you're drinking, right? So those sorts of things lead to non-optimal situations for people, but optimal situations for COVID to take advantage and spread. And so things like limiting access to beaches, limiting access to bars, that helps to stop the transmission of COVID.
And along a similar line of beaches, have the beaches restriction made a difference in the tourism?
Yeah, so I'll let Manager Zanoni handle that too, but in the last couple of weeks, we've been showing graphics that show from these little veins and arteries from all over Texas how they come to the coastal bend, where people are coming from, and we've seen that number decline by around 35 to 40% from the, before this outbreak occurred to now. Now, that being said, Manager Zanoni maybe has more.
Yeah, I think that's confirmed also by other statistics to include the number of persons going over the causeway, the JFK Causeway onto Padre Island. So around the Memorial Day holiday, when the beaches were not restricted, there was about 25 to close to 30,000 vehicles in a 24-hour period going over that bridge. With the 4th of July closures, there was less than 4,000. So just by volume of numbers, you can see there's a 20,000 vehicle with several persons per vehicle reduction in number of people going to the beach. Mm-hmm. Yes, sir.
How long of a period do we need to see a drop before you think we're actually getting on top of it?
You can stay there because I got a mic too. So, I mean, we're getting on top of it now. We can see that that's happening now, but if we stop getting on top of it now, it's going to be very quickly, jumping off again. In about 10 days, we would start to see, if we stop today, in 10 days, we would start to see the effects in the number of cases and and then a longer delay for hospitalizations and things like that to start to go back up. How long will it be until we get a hold of this in terms of holding it down, getting it all the way back down to say, under 100 cases per day, under 50 cases per day? It's going to take a while. It's going to take a prolonged effort at the same level that we're putting in now for that to occur. The more effort we do to social distance now, the faster we go down. The less effort, the slower, or even we transition to going up. And so it's hard to predict the future, but we know from the cell phone data that maybe for the next 2 weeks, we'll continue to see a decline like we have now. And the one thing I'll say is that City Manager Zanoni saw maybe if you looked in really close day to day, maybe a little bit of an upturn in the 300s for several days this week is a little bit of reason for concern. But if you looked at the cell phone data really closely with the number of encounters, you saw that on the weekends it was starting to go back up before it dropped back down with the hurricane. And that could be something that we're seeing an effect of, where it wasn't just last week. There was a good amount of time. There's a few weekends included there where we saw an increase in the amount of encounters that were occurring. So, but with the hurricane, it looks like maybe we're gonna stay with the same amount of social distancing and the same trend downwards for the next week or two, hopefully.
Good. This may be an Annette question. So if someone dies at home and is not discovered for several days, is the date of discovery on an estimated date used?
That's a great question. The medical examiner could actually give that date of death for that individual, but it would be based on medical records and it would be based on after fact. The person that normally signs the death certificate for people that die at home is actually the physician. So they normally have a physician. They would contact that physician, and then based on that history, they would sign that death certificate as what day they believe that person died.
And that's all the Facebook questions.
Thank you.
Okay, so thank you, Dr. Bird. That was a great presentation. And last week, did you present last week, Dr. Bird? Something happened last week, right? We had the hurricane last week. That's a fast week. But anyway, thanks for being here live today. And the presentation is on your website again, if somebody wants to watch it, right, slower, or watch it again later on this evening. That does conclude our press briefing. We want to see if there's any questions aside from the ones we just answered from the media.
I'm not sure if this will be there for you or not.
Okay.
So the difference in the daily numbers that the state had, did the state conduct those tests, or where did those tests come from that the state had?
The test came from the same locations our numbers came from. Right in that, it's the drive-through, it could be a hospital. Yeah, we'll have Annette answer it. The question was where those tests, where were the tests taken?
So a lot of those 555 came from, they go through what we call the NED system. It's the National Electronic Data Surveillance System, NEDSS, and it's coming like from LabCorp. They report directly into the NEDS, which goes to the state, and that's how the state ends up with them. And then they disseminate them out to the right county. So Nueces would get theirs.
Are you conducting the tests though?
Am I what?
Are the swabs being done here? So is the county conducting it, or is it a private lab, or is the state conducting the testing?
Well, remember, these are individuals that live in Nueces County, so probably the majority of them are actually tested here, somewhere in the hospital or at a doctor's office, and they go through LabCorp.
It'd be your drive-through testing site, the lab, the hospital. Who actually did the swabbing?
Well, it depends. It could be the hospital. It wouldn't be us because we use our own lab. But it would be like the minor emergency cares could use LabCorp, whoever actually uses them.
So whoever
And then
uses
they
LabCorp
actually,
is
yeah, they swab
taking
them and then they send them off,
Okay.
right, and then we get them back.
Thank you.
You're welcome.
Okay, those are good questions, Courtney. Any other questions from our media outlets today? Okay, great. Well, we want to thank the media outlets that are here and the ones we can't see that are getting this live from a feed from the city for being here. And we especially want to thank the persons watching that continue to watch each day. This is good information and it helps to inform the community. So with that, this closes our briefing for today. We'll be back Monday at 5 o'clock. Have a safe weekend. Thank you.